When my daughter was small, I brought her to my hospital, the Philippine Heart Center. I showed her the building, and she asked me, "What do you do, Dad?" And I told her, "I take care of patients. I take care of people who have heart disease." And then she asked me again, "Do you go to their houses?" I answered, "No, I wait for them here in my building at the Philippine Heart Center." And then she said, "But what happens when they cannot come to you? What about those people who live in the mountains or who live beyond the sea?" Now, many years after, she is already a doctor, and that question still rings in my ear. What about those who cannot come to the Philippine Heart Center? Especially that our logo or our slogan at the Philippine Heart Association and the Philippine Heart Center is "No one should be left behind." Now, this has become a challenge for me. I am a Filipino, and this is my country, the Philippines. We are 110 million souls sharing these 7,100 beautiful islands separated by large bodies of water. They say it's fun in the Philippines. It's always fun in the Philippines. And we love to smile and laugh. We have such a good sense of humor that even during typhoons and big waters, we can still manage to smile. We have very good sense of humor. And where did this come from? Well, from the Filipino soul, the Filipino spirit. We're the country of smiles because we believe in God. We're a very religious country, and we believe if we could just touch the clothes or perhaps embrace the cross of Christ, we will all be saved. So we celebrate beyond our means sometimes. We love to make fiestas or festivals, and we also love to eat food. That is the reason why for the last so many years, ischemic heart disease is still the number one cause of mortality in our country. And we're leading the other neighbors in the Asian region, highest in the world, highest in the Asian region, uh, age standard death rate from cardiovascular disease. And the challenge to tackle that lies at the Philippine Heart Center. We are a government-owned controlled corporation with a level 4 premier cardiovascular center in the Philippines. We are also an academic center of excellence for education and training, and we are considered as a cardiovascular research hub in the country. We are also the number one surgical referral center in the Philippines. We surgerize around 4,000 cardiac patients, only to drop by in the year 2020 because of the pandemic. We are located in Quezon City. It is in the heart of the National Capital Region. And you can see in this slide, in this table, most of our patients come from the National Capital Region. And as you go down, as you go far away from the National Capital Region, the number of patients dwindle down. So we noticed that if people cannot come to us, we must go to the people instead. And we decided that the burden of cardiovascular disease has to be shared by everyone, not just by the Philippine Heart Center. We're just a 500 cardiovascular institution serving 110 million Filipinos. We have to spread out. So, since the Philippines is divided into 17 administrative regions, we said there should be a heart center for every region. We dreamt of an accessible cardiovascular care for everyone since we were instituted in 1975. So we said, now is the time to spread out. We talked to our graduates, to our consultants. We asked them to go back to their premises, stay and serve. We asked them to institute therapies impacting people's lives. And we beseech them to start a revolution of caring, to come to the people who are sick and fulfill the promise to be there no matter how far. We also included nurses, med techs, we also have perfusionists, we have also rehabilitation specialists, we have anesthesiologists, cardiovascular surgeon, pulmonologists, pulmonary specialists. We're a team because we're promoting the heart team. So we studied our resources. We need specialists. We need places where they already have our graduates there, specialists. And we want to see if that region has established hospital. And we want to count how many people can it serve. The goal is to increase the access to care for more Filipinos while rationalizing the distribution of resources. We met several times. In 2016, we actually have seen and went and discussed and met with the Department of Health, with the government to seek help and sustenance for this project. We met with so many medical societies. We met with local government units. We met with governors, with congressmen, with mayors, with municipal health officers to create this development plan. We're looking for regional hospitals who have a capacity of managing all simple cases of cardiovascular disease and some complex cases with option for National Health Center assistance, meaning if they cannot handle the operation, we can come to them and assist. We also need specialized multidisciplinary teams, and there should be full clinical services in the region, in that hospital. The regional hospital should have a complete heart station with at least one cardiovascular operating room and at least one cath lab. We also need them to have at least 3 cardiovascular surgeons, including one pediatric cardiovascular surgeon, or at least one visiting or an in-house cardiovascular anesthesiologist, at least a pediatric anesthesiologist, and an adult cardiologist. We also, if they do not have, we plan to train them. We train cardiovascular nurses, we train perfusionists, and we also help them put up the infrastructure. We gave them equipment upgrades. We envisioned each hospital would be spending around 25 million per cardiovascular operating room and 2 operating rooms per regional specialty center. We're estimating that they would spend 100 million pesos for a fully equipped cath lab capable of adult and pediatric interventions. We were estimating that they would probably need at least 5 to 10 beds, ICU beds, and we were estimating that each bed would probably 1 million, would cost 1 million to be a complete monitoring unit. We also prioritize their training. We asked them to send the best physicians for the heart center to train them as cardiovascular surgeons, anesthesiologists, cardiologists, pediatric cardiologists, nurse practitioners, operating room nurses, and ICU nurses. So the dream is to sustain their activities. We also refer them to the Philippine Health Insurance System. It is the government insurance system where they could do coronary artery bypass grafting, VSD, and TOF repairs, and give it for free because the PhilHealth will sustain those surgeries. We also did outreach heart missions. We went to their hospitals for proof of concept to let the people know that it can be done in their area. We also taught them basic and advanced life support, and of course, prevent public health cardiology. By the year 2016, we have done at least 92 patients. This is one of those, Western Visayas Medical Center, where we did 21 patients, 9 VSD patients, and 12 PDA patients. That was just in the beginning in 2016. Our goal is to set up independent heart centers. And we also have rubrics. How can you be considered or recognized as an independent regional heart center? First, you have to perform a minimum number of procedures so that you could also maintain the accreditation for PhilHealth, for a no balance billing, so that you could serve the patients more. And then we also tell them that your outcome should be at least not more than 5% mortality rate. We also required them to do simple CV procedures, their cath labs. By 2019, we have at least 4 to 5 hospitals ready for full implementation and independence. These are pictures of our medical admissions to their regional heart centers to show proof to the people there that open heart surgery or closed heart surgeries can be done in their localities. This was a table of readiness maturity assessment of regional heart centers in 2016. As you can see, most of them are green, but there are so many yellows and a few reds, meaning not yet available. But in 2021, we have at least 5 fully capable and fully mature regional heart centers. And 2021, this is like a Christmas tree. There's also a lot of yellows and reds, but they're already in the process of being accomplished. The Philippine Heart Center is also an awardee of good governance. So we also taught them how to manage their hospitals. Moving forward, we see ourselves continuing the development of regional heart centers, complete training and staff of competent certified specialists with support for infrastructure and equipment requirements, strengthen our collaboration with the local government units for basic cardiovascular care, and promote multi-center researches. We would do our researches at the center with them. We would also continue conducting our outreach heart missions to their regions to show everyone that their own hospital can be trusted to do open heart or closed heart surgery. We also went to the Senate to ask for legislation to facilitate access to specialized medical care in appropriate funds. So in 2020, we were granted this legislation, establishing satellite specialty hospitals to facilitate access to specialized medical care in identified regions of the Philippines and appropriate funds therefore. So our aspirations is to provide safer, better quality, and more efficient healthcare for all our patients. The Filipino patient deserves to have the best possible care, and to inspire the Philippine health sector that best quality healthcare can be provided by government hospitals, even for the poorest of the poor. This is our dream for the Filipino heart patients and our dream Philippines. Thank you very much.